This is the guy who, legally speaking, was out in the forefront of all the stuff going on during the pandemic. He was the one telling the truth about what was going on with those shots. He was the one telling the truth about how you can't be pressured into putting something into your body, even though everybody was saying that you could. He was the one who said, tell us what's in these vaccines. It's attorney Tom Renz. Go to tomrenz.com, TOMRENZ.com. Tom, it's good to see you again. It's been too long.
It's been way too long, Joe. Great to see you. You're doing some great stuff with this show.
We're trying our best, and I really appreciate you saying that. Is your podcast still is it an everyday podcast? How often can people see you do your thing?
5 days a week. We just moved the time to 4 p.m. Eastern, and we just updated and upgraded all sorts of things, so it's all fancy now and super special.
Just TomRenz.com to find it?
TomRenz.com. You can find us on Rumble, The Tom Renz Show. We run on my X profile every day, at Renz Tom. We're all over the place. Not YouTube, though. You can't find us on YouTube. They throw me off every 5 minutes, and so does TikTok.
Yeah, how dare you possibly talk about things that would actually help people, and how dare you tell the truth? Tom's been telling the truth since day one. I got to skip right to something that I had in my notes here, that you actually were in front of the Supreme Court recently. What is it? First of all, what's that like? Why can't we have cameras in there? I want to see them in action. But what's that like? Is it daunting? Is it scary? Is it just another courtroom? What is that?
Well, I was. It's the Supreme Court. I mean, I'm honored to be licensed. I wasn't arguing there. I was there for the Frontline Doctors event. But it's an impressive thing as a lawyer to walk into the Supreme Court, and it's kind of a mixed feeling. The thing about it is as an attorney, that's the biggest venue you can play in, and we look at it, and it's kind of, at this point, I've got this kind of jaded view of justice because I've watched so much corruption in the courts, and there's so many issues in the court. And part of me feels such honor and pride to be a licensed attorney that can serve. And I'm licensed in the Supreme Court. I'm able to do that, and that's such a privilege. But at the same time, I look at our justice system and I see the injustice. I see what they did to Rudy Giuliani. Now we find out all the stuff that he was saying is probably accurate. We see Sidney Powell got drugged through the ringer. I myself have been drugged through the ringer, and I see the corruption in the court system, and so it's kind of a mixed feeling. I mean, it's hard not to have awe and respect when you walk into the SCOTUS, but then you see some of the nonsense that comes out of how do you define a woman? Well, I mean. So you get a little bit of mixed feeling with it right now, honestly.
No, I'm with you. It's Tom Renz. Go to Renz Tom over on X and go to TomRenz.com as well. The reason I ask about the Supreme Court, I've never been inside of there. We hear their audio every so often. I know that the frontline doctors are doing an unbelievable job, and they continue to do that. They're trying to educate like you've been trying to educate. The fact is, even though we all know the truth now, where it came from, we know the truth now, mRNA stays in your body, goes anywhere it wants to go, doesn't just leave. Your body is giving it a hyperreaction to the spike protein. We know all that stuff, Tom. How are they getting away with continuing to lie to us? Because every once in a while, I hear an ad that says, hey, go get your shot, go get your booster, go get your mRNA this, go get your mRNA that. Have we not wisened up as a society to say, hey, hold on a second, we got a lot of questions about this stuff. How are they getting away with the lies?
Well, there's two things. So first of all, Bobby today, I don't know if you just saw this, but Bobby actually just withdrew support for new mRNA vaccines. They're moving to a new thing. It's called Universal Vaccine Platform, this is brand new, breaking today. Bobby announced, I think there's about 500 million that he pulled off of mRNA development and moved to, but he hasn't pulled the mRNA vaccines that exist off the market. Now, listen, Joe, we all love Donald Trump. Trump is he's a wonderful guy.
Yes.
But here's the problem. His chief of staff, Susie Wiles, worked for a bunch of companies that represented Big Pharma. She's very tight with them. And there's no question about that. Bobby, when he went through confirmation, Cassidy, some of these guys, they were very clear. They're gonna be up his rear. Yeah, I'm of the belief that Bobby's been very limited in what he can do. Now, I'm ecstatic about him pulling support for future mRNA vaccines, but we need to do it much more robustly. We still have what's called saRNA being fast-tracked, which is a nightmare. There's now RNAi sprays that they're spraying on our crops, which are, we're putting this right in the food supply. We're putting the mRNA injections into animals, more in the food supply. We're getting this stuff out there. Yeah, and they're doing some of this through the EPA instead of HHS, right? So the spray that they're putting, the RNAi tech, which is this is just another mRNA, right? So mRNA as a platform has been developed into a bunch of different things. It's being used in a bunch of different places, and they are just hell bent on getting it into the human bodies.
Let me stop you, Tom, because it begs one question. People listening, people watching are screaming at whatever device they're watching or listening on, going, why? And that's always the question. I've interviewed Dr. Malone, who came up with mRNA. He also is like you. He doesn't want this out there in the food supply. Was not for these so-called vaccines either. But why is it that they want to put it in? Is it to control us? Are they trying to sell us on some health benefit? Answer the why for me, if you don't mind.
Well, the official why is to, because it's going to help, improve the health of animals, better production, better yields in their crops, that sort of stuff. But I think that's all nonsense. I mean, there's been a lot of testament about the fact that these mRNA shots are not healthy for animals either. The real why, in my opinion, is to create permanent long-term customers for pharma. This stuff that makes you sick, right? The delayed adverse reactions. There was a 2006 document from the FDA that I've talked about a lot. 2006 show, and in 2006, that document defined gene therapy technologies in a way that would include the current mRNA vaccines, and it said specifically that there is a high risk of delayed onset adverse reactions, including cancer, autoimmune issues, and other unnamed. Now, think about this. We're several years out from the origins of these mRNA. We got all these boosters. What do we see happening? Explosions of turbo cancers, explosions of all these autoimmune issues. How many people? I just had a friend I just saw this weekend. He's having all sorts of issues. He's suddenly getting hives all the time. It's an autoimmune response.
Yeah.
Right? Eczema, psoriasis, all these different things. We're seeing all these things pop up that are autoimmune issues. This is predictable. I'm of the belief that Pharma knew that this was going to happen. I'm of the belief, and I can back it up because in 2020, prior to the release of the COVID vaccines, the VRBPAC, which is an FDA group, they meet to talk about this stuff. I think this is October, November of 2020. They meet, and they've got this list of adverse events they're going to watch for because they think that these vaccines are going to cause it. They knew then that it was going to cause strokes, embolisms, myocarditis, all this stuff. These things were all listed. They knew this was coming. I think that the reason that they're putting this out there is this creates permanent long-term customers for pharma. And it's working. It's working. I mean, almost 80% of Americans got at least one of these shots. So that's almost 80% of Americans that are now probably going to have some sort of a long-term health issue.
Tom, I was stunned by that number. You're right. It's about 80% that got the shot. I didn't get it. I know my family didn't get it because we didn't know what the hell was in it. We didn't ask. It wasn't an outrageous question. Hey, you want me to get that? What's in it? What does it do? And they literally couldn't answer that question. Either they didn't want to or they couldn't answer it. Then they lied about it's specific to the lungs. It doesn't go to your brain, doesn't go to your ovaries, doesn't go to your testicles. Well, when it turns out it goes everywhere and it doesn't go away. Plus, it never leaves your system unless you take some sort of treatment to get rid of it. The VAERS system that was good for years and years, we were told, ignore VAERS. The adverse effects aren't real. VAERS is wrong. Tom, it turns out you were right the entire time. Dr. McCullough was right. Dr. Malone was right. I was right. Dr. Urso was right. Dr. Lopez was right. So what do we do about it now? I agree with you. Big Pharma wants us to be their customers forever. I don't want to take anything from Big Pharma. I'd rather just be healthy and prevent being sick and being a long-time customer. But what do you do when 80% took the vaccine? You've got these pharmaceutical companies that are every other ad on everything, radio, television, everywhere. They're pushing some new drug. What do you do to fight back other than just tell the truth like you're doing?
Well, the biggest thing you got to understand is legally.
Should the government do something?
Yes. Okay. We have to push for policy change. And one of the number one things, so I know this to be a fact. I know that there were a group of scientists, I'm not going to mention names, who were set to go brief Donald Trump on some of what's going on with this stuff. They were blocked. There are people preventing this information from getting up the food chain to Donald Trump. We need to really speak out. We have to take a strong stand on this. I mean, listen, again, I like some of what everybody's doing in this administration, but when you have a chief of staff, and then also you've got Pam Bondi, she was working as a lawyer for Pfizer right before she took the position of AG. I mean, do you think she's going to go after these guys? This should be one of the biggest RICO cases in history. This should
Yeah.
be crimes against humanity. There's so many things that should be happening, but we can't get any accountability. Now, Paul Gosar just introduced a legislation to roll back the Vaccine Act, right? Which would remove this immunity shield, right? But in the meantime, we see the Department of Interior appropriations bill. They're trying to expand that sort of vaccine-like immunity to cover things like glyphosate, which cause cancer, and all these other chemicals that they spray on the food. So what's happening right now is, honestly, we've had such incredible success in waking people up to the dangers of vaccines that they're now kind of shifting. They're trying to remanufacture vaccines using this new platform, universal vaccine platform, and rebrand and try and tell you it's going to be safe, gold science. Meanwhile, they're trying to take some of these poisons, these mRNAs, these pesticides, these things. And the MAHA movement really now needs to expand beyond vaccines. And so I'm spending a lot of time looking at foods, air, water, all these different things, because they're now really pushing this stuff there. Remember, Pharma doesn't just make pharma. They also own Big Ag. They make the vaccines for the animals. They make the pesticides for the animals. Bayer Pharmaceuticals owns Monsanto. Bayer Pharmaceuticals is the one that's pushing for this immunity bill. And by the way, they're claiming it's not immunity. They're claiming it's a labeling bill, but it has the effect indirectly of creating immunity through undermining the ability for state causes of action that they're suing. Bayer Pharmaceuticals is doing this because they're losing billions on this Monsanto.
Well, I got to throw this out there. I got to throw this out there because I want to understand it as well as you do, and I'm not going to get that in the next 10 minutes. Having said that, I'm okay with vaccine immunity if it's not forced on us and if it's actually a vaccine. They literally redefined what the word vaccine means during this whole, Fauci garbage that we got in, and some penguin got bitten by a bat who somebody ate the penguin. The whole thing was just, it was based on a lie. We still to this day, I'm not sure, know what's inside of these mRNA shots. I mean, isn't it as simple, Tom, as just saying a vaccine is something that actually stops you from getting something? It is a perfect medicine to prevent you getting this thing that's because what we had wasn't that. They lied about it. They said that it stopped you from getting it. It didn't. In fact, those who took the vaccine many times are getting COVID more often than somebody like me who never took it. So can we go back to the original definition of vaccine, and then the immunity makes sense because it's for measles, it's for mumps, it's for smallpox, and it actually works? Or are we beyond that now?
Well, let me throw this back at you, Joe, because I didn't know this. Remember, I was pro-vax before all this started.
Yeah.
I was right there with you on all of this. I thought the whole anti-vax thing was nuts. I've personally looked at this. Do you know that the reason that they passed that act is because Pharma told Reagan and told Congress that vaccines are inherently dangerous. So these measles, polio vaccines that they've been touting for decades, they were always known to be so dangerous that they had to have immunity, right? So think it's like
they admitted it up front, and we still gave them immunity.
That's why they said we're going to quit making vaccines unless you give us immunity. That was the threat. They threatened Reagan. Now, I'll tell you, here's the other thing that I was very surprised about. Bobby's talked about this, and I looked at it myself because at first I didn't believe it. And I went through and I've looked. I have not found, and I can tell you, I've verified this, there was not a single gold standard peer-reviewed study that didn't have some major issue in it on any of the vaccines on the childhood vaccine schedule. Not one. There are no proper studies. They don't study these. And what they use is they use these tricks, right? They use these legal tricks, these regulatory tricks on these vaccines. So take the flu vaccine, right? So every year you get a new flu vaccine. That's why you need a new jab. And they say it's because the flu changes every year. Well, they use what's called the substantial inferiority standard, right? So if the new vaccine isn't substantially inferior to the previous vaccine in terms of safety or efficacy, they just say, oh, it's okay, right? Well, how do you know if that's any good? They use that same standard to approve this new Moderna COVID vaccine, which is mRNA. Well, here's the problem. We all know how bad the studies were on the original mRNA vaccines.
Yes.
So what they've done is they've created this whole industry that was based on lies. None of these vaccines have ever been studied against gold standard and gold standard studies. None of them have ever been proven safe or effective. And what they've done is they've just said, listen, we've got to have immunity because we don't know that these are safe or effective. And when you go back and then look statistically, one of the things that shocked me even more is you say, well, yeah, but look at the polio vaccine ended the polio epidemic. Look at this vaccine did this. In every case that they cite, I've been able to go through, and I've looked extensively. In every case that they cite, I've been able to find what you'd call a confounding factor, right? Things that throw the statistics off that say that the case that they're making isn't necessarily true. And the thing about it is if I apply those standards evenly across the board, if I say those standards apply to my argument in the same way that it applies to their argument, I win every single one of these arguments.
Wow.
There is no demonstration. There's been no demonstrated proof of safety or efficacy on these vaccines. And Joe, my kids are fully vaccinated. I didn't believe,
Right.
I mean, they didn't get the COVID stuff and they're not getting
Right.
any more, but
Right.
I didn't believe any of this. As a mainstream guy, until I did the homework myself, I didn't believe a word of it. I did the homework myself. And I mean, you know how I am about this. I've been doing it and I haven't been wrong on too many things.
Right. It
These
is Tom
are
Renz.
not proven.
TomRenz.com, RENZ, TomRenz.com, Renz Tom over on X. With Robert F. Kennedy Jr. at the helm at HHS and in charge of MAHA and being very skeptical about vaccines, we're not in a better place now? I feel like we should be.
Oh, I think we're definitely in a better place. The question is where are we going? Because now medicine is moving. So when I was in DC, along with being at the SCOTUS, I was also at a couple conferences. I talked to a lot of people. Medicine is moving to AI. Everything is going to be AI driven. And that's a kind of a creepy thing in and of itself. One of the plans show that they actually have, and this is for real. This sounds like sci-fi, but this is for real. They want to gather enough of your medical data, and you can look at the executive orders on this. They want your genetic info, they want your medical data, your behavioral data, and they want to create basically a virtual AI doppelganger of you. And then they want to use that to test different formulations, different things to create customized medicines for you. That's where healthcare is going. It's not going to be there tomorrow, but over the next 5-10 years, that's where they want to go with this.
I don't like that at all.
Now, it's just downright creepy.
It is.
You know, you're gonna see doctors removed from the equation largely. And what's happened is because of the way Obamacare created this electronic medical record debacle, the electronic medical records were supposed to be records. But during COVID, electronic medical records were used to control and to create the hospital death protocols that we saw killing people all over the country. I'm getting ready to release a white paper on that. And they did it because when the doctor says he puts in your symptoms into electronic medical records, those electronic medical records say, we will allow you to do these tests or to offer these treatments. Nothing else. The doctor doesn't get to decide what you're doing anymore. The EMRs do. And that's top-down driven. That's driven from CDC, HHS from the top down. So now we're going to make this even worse. We're going to have AI in there. And the doctor is really going to have very little to do with your treatment. This whole thing is going to be top-down driven through an AI system. And I just don't trust it. I really don't.
Oh, I don't either. I don't like that at all. It's Tom Renz. Tom, I'm almost out of time, but I want to go a little bit longer because I don't want to miss this one topic that we wanted to get to. The American Academy of Pediatrics is literally saying they want to get rid of religious and personal exemptions for vaccines. In other words, if I've got a religious belief that says you can't enter that shot into my child's body, the American Academy of Pediatrics says we should get rid of that exemption and just say, screw it, you've got no freedom, no religious freedom, no liberty whatsoever. You'll do what we say do, and that's that. That's really what they're trying to do?
That's absolutely what they're trying to do, and I'll tell you why. Most pediatricians see an actual majority of their income comes through vaccinating kids. So their constituency, the pediatricians that make up their group, they make all their money off of vaccines. There are pediatricians that make over 90% of their revenue from vaccines. Not all of them, but a lot of them. And almost all pediatricians make a vast majority of their revenue from vaccines. The vaccine biz is big money for pediatricians. They don't care about health or safety. All they care about is driving the income of their trade group. That's what they do. But
it's literally un-American, though. It's literally un-American to say your First Amendment right doesn't matter. Take the shot.
Oh, it's beyond un-American. Think about, listen, we have the First Amendment, particularly with religious freedom. Religious freedom is pretty unique in American law because you not only have the First Amendment, which explicitly protects it on a profound level, but you have also got the Religious Freedom Restoration Act, right? The Religious Freedom Restoration Act very clearly tells the courts that anything related to your religious freedom needs to be reviewed under what's called strict scrutiny, which is the highest standard of review you can have. There is really very little justification for this if you look at the real science behind this, and if you can put the real science in the courts. Now, I would love to see this challenge. I'd love to challenge it myself, but this is an abhorrent thing, and we now have several states that have actually done away with religious exemptions already under state law.
Completely unconstitutional. Completely
mind-blowingly unconstitutional in my mind. I mean, my body, my choice, right? They're all leftist states. My body, my choice. If you want to kill your baby, but not if you want to decide not to take a poison.
I mean, the irony is lost on dumb people. It is Tom Renz. Go to Renz Tom over on X. Go to TomRenz.com. Took a major financial hit because of his belief in telling the truth, his steadfastness in making sure that our families all knew what the real truth was about the pandemic and where it came from and the medications and everything else. Go to TomRenz.com and support him if you can. Check out his podcast Monday through Friday as well at 4 p.m. Eastern. You said 4 p.m. Eastern time, right?
Yes, sir.
Go and check it out. Tom, we got to do it again because we about 2 hours worth of stuff that we need to talk about. We got a lot in here, but I love the work you're doing for all of us, and I appreciate you.
Thank you, Joe. Great to see you again.
All right, good to see you, my man. We're back after this. Stay right here.